Hi, I'm Dr. Michael Abernathy. I'm back. It's kind of like, you can't get rid of me here, but we'll keep this short. I think it's important information today. Last time we were talking about mindset, and I want to kind of get you in the mood here. Uh, you've gathered your numbers. You know what your diagnosis is: good, bad, ugly, average, whatever. You've seen those numbers. We're talking about using a mindset of you just purchased a practice, okay? Somebody else's practice, but you're looking at your own. But you need to pretend it was somebody else's practice and look at those numbers as, a young doctor would, that you were willing to do whatever it took to make this practice better than the previous doctor. What steps would you take? Where would you start first and what would you do? Now, I want to kind of help you with that mindset too, because like it or not, in a small consumer driven business, and that's what we are. Patients or consumers or our clients have the choice of choosing the doctor or the product or the services that they want to spend money on. So patients vote with their feet. And so if you've got less than 20 or 30 new patients, there's a problem. And so I want to give you a little more depth on mindset. Now, like it or not, there are two different types of practices out there. We have donor practices and we have recipient practices. Now, you'll notice that we may mention donor and recipient again in other videos. I mean, if we were talking about marketing or we're talking about keeping staff or there are certain symptoms of both of them. And I'll just speed to the end and let you know what you want to be as a recipient practice. But my practice, I followed where my patients came from. We had almost an 80% direct referral rate, even though we spent a lot of money on marketing. But 80% came from other patients that had visited us, liked what we had to offer, told their friends and neighbors, and came back. Okay. Now, funny thing is, in tracking this, I identified 3 offices, 2 general practices and an orthodontist, because we did ortho in our practice. An orthodontist that we got a lot of patients and patient record transfers from those offices to our office. And I started looking at why. And so I want to talk about donor and recipient practices. Now, a donor practice isn't necessarily a bad practice, but a donor practice tends to lose patients. It's called attrition. Now, in average, little town, big town, United States, the normal attrition rate without you upsetting a patient, anything else, they just come and go and move, stuff like that. Attrition rate is about 17 to 20%. It could be a little bit more, it could be a little less, but somewhere, let's say between 15 and 20%. Okay, that's average. You're just going to lose that many patients. Really, like a super general dental practice can get that down where it's below 5%, but average 15, 20%. Now, in donor practices, it's going to be higher than that. And a lot of doctors don't realize they're a donor or recipient practice because they don't look in the right places and they don't really ask the right questions. Okay, so I want to give you a little homework here. I want you to go look, since most people come through your practice through hygiene, I want you to go back and assume that your hygienist is pre-booking everybody that she can pre-book in the future. Okay, now just go look at your practice management software and look out 3, 4, 5 months, somewhere inside 6 months, and take note of what you see. Your hygienist, if I were talking to them, would say, "Oh yeah, I pre-book everybody over 90%." Okay, and I go out there and look. You're gonna see one of two things. One, the whole day's full, which is bad in one sense because there's not room for a new patient, but she did pre-book them all, okay? And then the other side of the coin is they said they pre-booked them all and there's only 4 people. And you look a week this way, a week that way, and you start noticing they're only pre-booking about 40 or 50%, or only 40 or 50% are coming back. That's a bad thing. That's a donor practice. Now, let's look at it one other way. Let's say you've been in practice and you had, let's say, 30 new patients a month. That's 360 a year. But you've been in practice with those numbers for 5 years, but you only have one hygienist. Now, It's not, brain surgery or anything, but think this through. A normal hygienist can only see 500 to 600 patients a year if they see them twice a year. If they see them 3 times, less than 5 to 600. If they do more scaling and root planning, less than 5 to 600. But let's say it's just average. Okay, so every 5 to 600 patients, and let's say 600, you should need to hire another hygienist. If you didn't need to hire another hygienist, there's something wrong. So it means that if you're getting 360 new patients a year and you're not needing to hire that hygienist, every 24 months, or even probably less, 18, then you're losing as many people as you're gaining. So I want to quickly go over, to help you see the difference between donor and recipient, the symptoms of a donor practice. Okay. So 1, increased cancellations and no-shows. Now, in a really good practice, we can keep cancellations and no-shows well below 10%. And even if we did have cancellation and no-show, we could replace them. But in an average practice, it's closer to 15%. Now, this is something that you don't track, but you need to go back and take an earnest look at some of your scheduled days and see what your average number of cancellations and no-shows are. A donor practice has an increased number of cancellations and no-shows. Now, this is something else your software will not track. New patients. The most important source of new patients is direct referrals. They'll say yes more often than not to your suggestions. They already like you because their best friend told you to come here. There's that bond's already standing, that you already have that entitlement of having a trusted person refer them to you. Okay. Now, if you're not getting at least a 50% direct referral rate, your office is not sustainable. Okay. Now, if we looked in the past, whatever we did there, because that's where we're looking, and now we go out 4-6 months and look at what's going to happen in the future, practices that don't get at least a 50% direct referral rate have fewer new patients, have higher overheads, and their hygiene department is weaker. Okay. Patients want second opinions. Okay. Actually, I could add something to that. Patients want second opinions, and they can't afford your treatment plans. Now, the ripple effect of that in a donor practice is you've overwhelmed them. You've presented too much treatment. You might have even assumed that patients want what you have to sell. You're going to find very soon that dentistry isn't about just marketing. It's not just about clinical excellence. It's about relationships. And so when we're talking to our patients, we need to be able to read them very easily. We need to decide with them. It's a partnership in deciding what treatment needs to be done. But if you're constantly getting patients at the front desk say, well, I need to talk to my husband. Well, if they say that, they're lying, because they're not coming back. But if a guy says, I need to talk to my wife, then yeah, that could possibly happen. But if they say, I want to get a second opinion, or they feel like I just can't afford that, it's not they can't afford it, they don't want you doing it. Because I think most people that do case presentations almost have 100% case acceptance. It just isn't you. It's like you presented it, but it ends up being done in the recipient practice, the one that they end up in, okay? So we can look at practices that have a lot of new patients, and they could be donor practices. Now, how would that make sense? Well, if we look, let's say they had more than the average. Let's say they had more than 30. Let's say they had 50 or 60 per doctor, okay? That looks like it's good. But you look a little deeper, and we look on the profit and loss statement, which you've already done in diagnosing yourself, and we see what you're spending on marketing. And we notice that you're spending 6, 7, 8%, yet are only getting like 40 new patients. And then we look ahead and you're not scheduling people, they're not coming back. Then you become marketing driven. You use the money to compensate for a lack of internal marketing and having people like you, okay? High staff turnover. Now, this is counterintuitive. Donor practices have high staff turnover. It's almost like patients can feel or smell or taste a great culture. And donor practices don't have good cultures, and so staff stay a very short period of time. Assisted hygiene. Sometimes that's the number one reason patients don't come back. You're taking your best hygienist, and they are probably the strongest person to deliver your culture and bind them to your practice, and giving that to an assistant who in most practices is the newest hire, the least educated, and the least likely to be immersed in the culture of the practice. It is just crazy. If you've got assisted hygiene and you're looking at the future, you need to free up their future. Let the hygienist take this over and be kind of the hub for your practice. The last is poor financial arrangements. And this is, it's real easy to see this all the time. The doctor goes, you need this, 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 and this. And then they take them to the front without the rapport, the trust, and then the front desk has real uphill battle to get patients to want the dentistry they need. And poor financial arrangements is just one more straw there. We have got to get great at using outside financing, carrying financing ourselves maybe at this time, parceling out the treatment to do what they want first and then do what they need next. And so if you'll take, tip a mirror up, look at your practices and see if you have increased cancellations, so fewer or no direct referrals. Patients want second opinions or can't afford your treatment plans, or you feel like, I am kind of marketed driven. I can't keep staff people more than a couple of years. I'm doing assisted hygiene, and if we use a routing slip with your practice management software, we notice that everybody falls off right after they do financial arrangements. They never come back. We've overwhelmed them, and you're a donor practice. Your mindset needs to give patients more of what they want and less of what they don't, and become a recipient practice. Thanks a lot.